Let everyone get in and logged in here. Good evening, Dr. Sherry. Let's see. Turn my sharing off here. Oops.
Can you hear me now?
We sure can. Thank you very much for joining us.
Sorry, I was just trying to figure out how to get it going.
It's okay. It can be kind of confusing lately. By the way, I'm Daniel Olson. I'm one of Mark's friends here. He asked me to help him out with hosting since I got a little bit of experience with this. So hopefully I am seeing your presentation, so you should be all set to go. And we are recording this for future prosperity.
Okay. Are we ready to start?
Let's give it just a couple more minutes here. I see some more people coming in and letting them get in. So let's give them another few minutes here to get in and we'll get started. All right, Dr. Let's give him just a couple more moments here and we'll get started. Make sure Mark. I'm actually getting Mark in on the audio here. Just one moment.
Okay.
Thank you everyone for joining us. Give it just a few more moments here. We're getting the actual host up and going, getting Mark and Lee up and going here. Just one moment, and then we'll get started. Let Dr. Sherry take over, and she can take the show here in a few moments. So just give us one moment. All right, good. They can hear now. I'm going to put up something in chat. I got a couple of individuals who don't look like they have sound yet. One moment. A couple more people coming in. Okay, Dr. Sherry, I think we've got the majority of our people that are going to join us on time here. So if you want to take over, and we will be happy to learn some new things today.
Okay. Hi, everybody. I haven't done a Zoom meeting as a presenter before, so if there are any issues, somebody please stop me. And I'm always open to questions. So today we're going to be focusing on freshly trapped birds and very basic first aid, since this is for primarily apprentices. So the first thing that I would recommend is before you trap a bird, please establish a veterinarian. The easiest way to start is by asking your sponsor if there's a good veterinarian in the area to use. If there's not one very close to you, there are two things I would recommend. One is a veterinarian who's close to you, who's willing to work with you and learn. It's helpful if they see bird patients already for more than just dispensing Baytril or trimming wings and beaks. There are resources that any veterinarian who's interested in learning more can reach out to and use on the internet or by phone consult in order to get more information to help you in an appropriate fashion. This is a lot more advanced than it used to be 20 years ago, before the internet was really much of a thing. And it really opens up the capabilities for a regular veterinarian to do quite a bit for you that's really helpful. The second thing would be an experienced veterinarian, preferably a specialist who can provide more advanced care. The care that we can provide raptors nowadays includes CT scans to find exactly what's going on, like inside of the sinuses, for example, or inside of the lungs. Endoscopy to look for evidence of aspergillosis lesions and potentially surgically remove large ones. Surgery to fix bone fractures to a really high level of care. So it's not the sort of thing where we can just throw antibiotics at it and hope for the best. We can really do quite a bit more. The specialist can be quite a bit further from you. You really need the nearby veterinarian for basic emergency care, and also for doing fecal examinations, microscopic examinations for basic things, and dispensing regular medication. Some of the resources that your local veterinarian can use if they're not super familiar with birds would include the Raptor Center at the University of Minnesota, which is the one that Dr. Pat Reddick started. He's not currently, he's retired now, but it's run by specialists. There are also other specialists at other Raptor centers across the country now, which also can provide assistance. And the nearest veterinary college will often have one of those, or be able to get you in touch with one, or just have that level of experience themselves. And of course, there's also the Veterinary Information Network at ven.com, which many veterinarians are already members of. And if they're not, it's very easy to become members of. And there are a number of specialists who can provide assistance with cases through VIN. Dr. Scott Ford is one of those. Dr. Ford has been a falconer himself, and he participates in quite a bit of wildlife work and has done a lot of work with eagles as well. There are a few personal pet peeves that I have when it comes to veterinary medicine. One of them is that a long time ago, we used to say that there were pathognomonic symptoms, or symptoms that said, if this is the symptom, this is the one disease that causes it. Avian medicine has come a long way in the last 20 years, and we know that there are many diseases that will cause very similar symptoms, so we do not like to refer to pathognomonic symptoms for the vast majority of avian conditions nowadays. So we should not assume that based on the appearance, it's got to be this. It's best to pursue a diagnostic test to confirm that. Second, please don't call Coccidia cocci. Cocci are little round bacteria, which include a lot of normal bacteria that we need. Coccidia is a protozoa, and coccidioides mycosis is a very serious fungal infection called valley fever, which animals can get and also people can get. So because there are so many things that start with cocci as the beginning of the name, it's strongly preferable to use the actual word. And the third thing is we can do more than just watch them die. A couple of years ago, I was at a falconry meet, and a physician happened to say that all the vet could do was just watch the bird die. And that is, in fact, not the case. There is quite a bit more that we can do. There are some conditions which we cannot treat, and there are some conditions which, while we could treat them, it's not worth the quality of life to the raptor to actually treat it. The primary example would be amputations in the vast majority of birds. Most amputations are going to render a bird either flightless or unable to properly hunt, with the exception of amputating a toe here or there. So we can do more than just watch them die. The question is, can you get your bird to a facility with those capabilities? With that in mind, we'll move on. The first thing that we're going to talk about is when you've got a freshly trapped bird and it's still on the trap. And your sponsor is going to provide you a lot of guidance in this area. But obviously, the first thing that we typically look for is the bird a haggard or a passage bird. Because if it's a haggard bird, the vast majority of the times, you're just going to be releasing the bird. There are situations where you may choose to keep that bird not for falconry purposes, but in order to transport it to a rehabilitation facility, and that is fine. If you are trapping and you trap a passage bird, you'll have to have a hard talk with your sponsor about what you should do if that bird has certain medical conditions, what your sponsor is comfortable with you attempting to take care of. For example, if you trap a bird and it has a few feather lice, often that is a fairly minor condition that's very easy to treat. On the other hand, if you trap a passage bird and it turns out to have some pretty significant medical conditions, most of the time you're going to be making a choice between, do you want to release that bird and let nature take its course? From a wildlife biology perspective, that is often preferred. Or are you going to take that bird to a rehabilitation facility? Because generally speaking, as apprentices, we don't want to be taking in a bird and then spending our first season doing rehabilitation work, because we won't learn anything about falconry if we're doing that. So those are conversations you'll have to have with your sponsor, and every sponsor is going to be a little bit different there, and your situation will be different if you happen to have a rehabilitation background or you work for a rehabilitation facility, then your approach may be different. So the first thing that I usually look at when I've got a bird off the trap is the general condition of the feathers. Are there broken or missing primaries? Is there an amount of feather damage that you can see from a distance as you're first approaching the bird? This is a really great time to look at the condition of the primary feathers, because the bird is usually fanning them out and trying to look as scary as it can as it is freaking out. The second thing that we're going to look at are the eyes, and The third thing then is right in front of the eyes, we have the nares, which are the nasal openings. We're going to look at the mouth. We're going to look at the feet. We're going to evaluate the keel score with whatever method your sponsor wants you to use. And then we are going to look for evidence of external parasites such as feather lice or ticks. So raptor eyes should have smooth eyelid skin with no growths or inflammation. You should generally think when you look at them that they look paper thin and that there is no pinkness or redness. There is a third eyelid, which is called a nictitating membrane, that will come from the inside of the eye and move toward the outside as part of the bird blinking and trying to clear its eye. That is a normal membrane. It also will look like it is very thin. It will not be pink or red or have any masses on it. The eye color of the bird, if it's a passage, will typically be very uniform. If you have red spots in the eyes or a red area in the eye, that is going to indicate that there is some kind of inflammation, typically speaking. And the cornea should look clear. If the cornea, which is the covering, the thin layer of basically skin cells on the outside of the eye that you can see through, if that is cloudy, that indicates that there is a problem. The nares are the nasal openings. They are towards the back of the top beak and in front of the eyes. They should typically be pretty clear of debris. If there's been a recent meal, there may be some blood or the occasional feather stuck to it. The nares have something called an operculum. That is a small protrusion of skin that's in the middle of the nare. And the area all around that operculum should be clear. But the operculum is simply present to try to keep large quantities of material from getting into the nares. There should be no tears in the nares, no swellings, and no growths. I mentioned that there should be no swellings or growths because avian pox virus is very common in a number of species of birds. It can occur in a very mild situation. The chicken that you see here is affected by a relatively mild case of pox. Some even milder cases may only have 1 or 2 bumps. Those bumps can be many different colors. Or it can be extremely severe, as in the deceased bird in the middle, which I have no idea what it is, or the bird with the severe foot lesions on the right side. Those are fairly severe lesions. Avian pox virus is fairly debilitating if it makes it painful for the bird to obtain food or to consume food, or if it's covering the eyes in any way. Supportive care is the only treatment. There isn't anything that kills avian pox virus. Mild cases can often just be cared for well, fed well, provided some protection while they're healing, potentially some pain control. The severe cases, though, if you trap a bird that has avian pox, you want to have a talk with your sponsor about whether or not that's something you want to, that's a bird you want to keep. When you look at the mouth of a raptor, it's going to be a pretty uniformly pink color. The exception is typically towards the tip of the tongue. There is usually an area that is paler than the rest, as you can kind of see here on the ferruginous hawk that has paler edges towards the tip of its tongue that looks a little different. That is normal. The opening of the trachea is actually in the back of the tongue. It's not visible in this particular photo. It's behind where the tip of that beak is. It's important to know the location of that tracheal opening. That's the windpipe. If you are ever giving liquid or food or medications by mouth, you do not want to place it in the center of the mouth, or the bird will aspirate, which means they will suck that into their windpipe, and that will cause choking and potentially pneumonia and potentially death. Instead, what I prefer to do is place the food in one side of the mouth and then trickle it down the cheek on the opposite side so that it actually is sticking to the cheek as it flows down the mouth. The feet need to be free of wounds, pox lesions, and bumblefoot. These are examples of bumblefoot lesions on the foot of a Harris hawk. Now, in our raptors, most of the time, bumblefoot is a condition that we see in birds that are tethered and are fat or have footing that is not padded, that they are either sitting on a long time or they're hitting harder than they should hit as they bounce back and forth in their mew. Bumblefoot is actually an infection that involves bone, and it's started by damage to the skin and a lack of blood flow. So most of our falconry birds are not going to experience this because we're going to fly them every day and keep them fairly slender. And we're going to work with our sponsors to make sure we know the best kind of perching surfaces for them to be on so that they don't overly traumatize their feet. But when you trap a bird, you want to make sure that you are not trapping a bird that already has a problem, because it is much, much, much harder to fix a bumblefoot lesion than it is to prevent it in the first place. When you look at the mouth, there are a few types of lesions that are fairly common, and you'll probably have read about these already as you're researching and studying for your exams. Frounce is a common term that is used for the protozoal parasite Trichomonas. It's also called canker. That's a pretty common word that's used in pigeons. This, on the left-hand side of the screen, is a picture of Trichomonas under a microscope. And then the picture on the right is a pigeon that has a Trichomonas lesion in its mouth. Classically in falconry, we consider pigeons the most common source for frounce to a raptor, but it is not the only source. Trichomonas is not particularly picky. It will live in any bird. Most of the time you will either hear people say don't feed pigeons at all, or you'll hear them say remove the head, neck, and crop of the pigeons before you feed it to your raptor. So this is a picture there of what that crop lesion looks like, but it is possible for Trichomonas to be present in a small quantity, since they're microscopic organisms, that you can't actually see lesions in the mouth of the pigeon, and that is part of the reason why experienced falconers will typically say remove that part of the pigeon before you feed it to your bird. It's also a wise idea to look at your bird's mouth every day, from the day you trap it until the day you release it, to look for any signs of lesions. And I strongly recommend that you see your veterinarian to do cytology of the lesions instead of just treating them. These are the treatments that are typically recommended. Metronidazole is an antibiotic that most veterinary clinics will have on hand because it's used a lot in dogs and cats. Ronidazole and carnidazole are available from falconry or pigeon supply companies. And those are things that typically a falconer will have on hand, the ronidazole or the carnidazole, to treat themselves. The reason that you want to do cytology to diagnose a lesion is because candida lesions can look quite a bit like frounce lesions. And candida is a yeast infection that requires completely different treatment. This is, on the right-hand side, we have a picture of candida under a microscope. So you can see that it will be relatively easy to differentiate the two for the veterinarian. And this is a picture of a hawk that has, and this is I think this is a buzzard from Europe. So it's not exactly a red tail, but closely related. And that is a candida lesion on the tip of its tongue. So this is a little bit different than the pale pink lesion or the pale pink tip of the tongue that the ferruginous hawk has. That's the same color that this buzzard's tongue should be underneath that yellow kind of bumpy looking lesion that it has. And candida is treated with prescription antifungal medication. So that's a different treatment than what the frounce treatment would be. So when you look at the bird, once you're closer to it, not at a distance, you look for evidence of external parasites. Ticks are fairly obvious. Most of us have an idea what a lot of ticks look like. You can see lice on raptors, and lice are typically larger insects that are fairly visible. Mites, on the other hand, are microscopic, and you're not going to be able to see them, but you can tell that there's evidence of feather damage if there are any significant numbers. So if you see feather damage to the ends of primary feathers or to the tips of tail feathers, that's most likely wear. That is just accumulated by the bird doing its normal stuff. If you see feather damage elsewhere, you're far more likely to have lice or mites. There are treatments that are over the counter that you can use for lice that are pretty easy to obtain. Carbaryl powder is usually called 7 dust. It's important that you not breathe it in and that it not be breathed in by your bird. Permethrin sprays are a little bit more popular, and they can be quite effective for treating lice as well. You typically have to get the bird doused with the spray fairly well and then repeat that later. There's the potential that we might be able to use a poultry treatment called Elector PSP that would be extremely effective against lice. I have not found evidence that anybody has actually used it for raptors yet. It's not something that I have had to use on raptors yet because the raptors that I have trapped have not had lice problems. Mites are something that you would typically only be able to have your veterinarian diagnose with a microscope, and they're treated with ivermectin. Ivermectin is something that you can get over the counter. It's not super toxic to raptors, but math errors are ridiculously easy to make with ivermectin treatment, and it is possible to overdose and kill a bird with ivermectin. So it's still recommended to consult your veterinarian if you need to treat your bird with ivermectin. This is a picture of lice here, and these lice are still pale colored at the top of the picture on the edge of this bird's eye right there. So, and that's not the only place you'll see them. It's just one of the easier areas to see them. Typically, we'll also ruffle the feathers after we've got a good hold on the bird to look for any evidence of those lice as well. This is the type of feather damage that you might see, especially with feather mites, which are going to be more microscopic. You'll notice that this feather damage isn't actually on the edge of the feathers. It's more towards the center of the feather and moving towards the outside, and the feather tips are still healthy. With internal parasites, that's not something that you can reasonably do yourself. They're fairly complex to learn to identify. That was not one of the first things I learned very well in vet school. It took some work to do. But I would recommend bringing a fecal sample to your veterinarian. And this is something the closer your nearest veterinarian can do for a centrifuged fecal float. If there are different ways that clinics do this. Some clinics will do a fecal float in-house and they won't centrifuge it. That's not a very sensitive method. If they do a centrifuged fecal float and they read it themselves and they have access to information about raptor parasites, then it's possible that they could do a really good job themselves. Or many clinics will send a fecal out to a large laboratory, and the large laboratories have staff who can recognize parasites of species other than dogs and cats. So that's a really good option as well. I recommend that you have internal parasite screens performed at trapping, at the beginning of hunting season, the middle of hunting season, and the end of hunting season. It is also not a bad idea to do in the middle of the training season, especially if it's not going particularly well, if you're having some challenges with a specific bird. Because I have seen birds that were doing well at the beginning of training, and then they started to fade later in training because it was taking a while to get them going, especially captive bred falcons, for example, especially if they're prairie crosses hybrids. So testing them in the middle of a training season, if it's taking a while, may also be a good idea. And then you treat based on exactly the parasite that you're seeing or that your veterinarian is seeing. So now we're going to move on to a basic first aid kit. These are the things that I recommend having in a first aid kit that I carry with me. So a sterile saline eye rinse is something that you can rinse the eyes with, but you can also rinse wounds with if you need to. Batericin spray or chlorhexidine solution are things that you can use to clean wounds. Fine tweezers or hemostats to remove foreign material. Band-aids, it looks like I put band-aids in there twice. Band-aids are really good around the feet. They're pretty handy for making a quick wound covering on a foot lesion. A light source, especially if you're like me and your eyes are starting to go. Magnification, because it can be hard to see little things, especially very small thorns and whatnot. I usually keep trapping supplies with me because you never know when masking tape or some nylon hose are going to come in handy if you really need to restrain a raptor in a big way quick. A hood or a giant hood, you're usually going to travel with anyway, but they can be extremely useful. Thermazine cream, which is 1% silver sulfadiazine cream, is the wound cream that I typically use instead of like a triple antibiotic ointment. Triple antibiotic ointments actually do delay healing somewhat because of the petroleum jelly base, whereas the SSD cream doesn't tend to. And SSD cream is very popular with all bird veterinarians for wound care. A quick stop or other clotting powder, usually something meant for toenails, typically pretty easily available anywhere that you can get supplies for your dogs. And usually a bottle will last you a really long time because it doesn't take much of it to do the job. Looks like I put Band-Aids on there twice. And then a way to warm your bird if something should go wrong, because we like to keep birds that aren't 100% healthy warm because it reduces the stress on their body to be kept at a warmer temperature. Chlorhexidine is something that you can order on Amazon. It comes as either a 2 or 4% solution. You want to make sure that you use solution and not the soap, because you're going to be using it to clean wounds and you don't want to damage the tissue. You have to dilute it to 0.05% or less, or it will actually be toxic to the tissues. And so those are on the screen, we have the dilution factors that you would need to use in order to achieve that. If you're using chlorhexidine to flush a wound, you do not want to use it around the eyes. Chlorhexidine is bad for the cornea. But anywhere else on the body, you use it liberally. The solution to pollution is dilution. So you want to wash that wound as much as possible. Another option that doesn't require dilution that you can get in a bottle and just keep in your vehicle is Vetericin, which they have the sprays that are more of a liquid. They also have hydrogels for wounds and all kinds of other products. But it's an antimicrobial wound care product that would also be really good to clean a wound with in the field and pretty handy to carry with you. This is the iron solution that I usually use. I get it at Walmart. It's really, really cheap and easily replaced. Oops. See if I can keep my screen on the same slide. The ABCs of triage. So there's not a ton that you can do out in the field, but there's some really important things. The ABCs of triage refer to the fact that usually we're trying to make sure the airway is open, the patient is breathing, and that circulation is going. CPR is not something that we can perform on birds. Their thorax, they don't have a true thorax, they don't have a diaphragm. The way their air sacs work is completely different from mammals, so we can't effectively do CPR. And it's not typically very easy to try to give them breaths either because of just their basic anatomy. So there's not usually much you can do there except to make sure that the mouth is clear and that there's nothing obstructing their trachea. You can stop the bleeding. That's a pretty important one. And the primary way that you stop bleeding is applying pressure. It's pretty straightforward. If you have a minor wound that is bleeding just a little bit, I wouldn't necessarily be in a big rush to stop a minor bleed, just because the blood coming out of the wound actually flushes the wound from the inside towards the outside. So a small amount of bleeding is not critical to stop. Anytime you're doing anything with a bird that is sick, you want to make sure that you don't constrict the chest. The way that their breathing works, they have to move that keel in and out in order to take a breath. And so anything that you do that presses their keel towards their spine is going to prevent them from being able to breathe and effectively suffocate them. If you have any doubt about what to do or are not experienced in applying splints or bandages, do not attempt to stabilize a fracture at all. Instead, just place the bird in its hood or in a giant hood or even in a plain cardboard box. And this is stuff that you can do with a wild raptor that you happen to come across if it gets hit by a car or something like that also. Because stabilizing those fractures is not a super critical right now kind of emergency that has to be done. And the potential to do the wrong thing is pretty significant. So the wrong thing, for example, might apply the wrong kind of pressure to the fracture site and actually force the edges of the bones further apart. Or it may cause a constriction of blood flow to the limb and effectively cause the limb to die. So those are some major concerns if you're not really familiar with how to properly apply bandages. Of course, flushing the wounds, the solution to pollution is dilution. That's pretty straightforward. That is something that you are very likely to have to do at some point with your bird because wounds are fairly common. I know in Texas, Harris hawks are frequently running into thorns. That's definitely a situation where you're just going to be doing a lot of wound flushing. And there's the safe concentration of Chlorhex again. Something I wanted to talk about is midwinter anemia. So this is something that you don't typically experience until a little later in the hunting season. Let's say that you get your bird trapped and you're start hunting and you've got the weight figured out and you figured out how much you have to feed the bird to keep the bird at that weight. Sometimes the bird continues flying at that weight throughout the winter and then suddenly crashes. And it's typically an anemia with a metabolic crash because it's basically been in a slow starvation process this whole time. And at first it could tolerate that low weight, but then it burns through any more reserves that it has and it can't any longer. Most of the time, experienced falconers will start increasing their raptor's flying weight throughout the season. So you will end in late winter or early spring flying at a little bit higher weight than you started the season at. A lot of that depends on the individual bird's personality, your weather patterns that you have wherever you are, and sometimes the species too. But a lot of birds get into the habit of hunting and they get excited about it and they may be interested in hunting at a higher weight than what they used to be. If your bird will do that, keep it at a higher weight because higher weights are always healthier for raptors than lower weights. Make sure that your sponsor talks to you about the signs of low condition and pay a lot of attention to your bird. And then adjust your flying weight throughout the season. You also have to adjust the flying weight from one season to another. So a bird in its second season may need to fly quite a bit heavier. My first red tail flew 40 grams heavier its second season than he did his first season, for example. And if I kept him at his first season weight, he was just too low and didn't quite have the energy. If you are presented with a bird who is in low condition because something's happened, and there are a lot of things that can happen and they're not necessarily your fault, or you may even find a wild bird that's in low condition, I want to discourage you from trying to immediately feed the bird. The first thing that we want to do with any bird that is really sick is to get it warm, because keeping it warm reduces the number of calories it has to burn in order to live. The second thing that we do is we hydrate the bird. So in a hospital setting, we will have the bird on IV or subcutaneous fluids for as much as 24 hours before we even attempt to feed it, even if it's a starvation situation. This is part of the reason why you will hear a recommendation to keep a sick bird in a warm, humid room, like a bathroom with the hot shower going. It's because it reduces fluid losses. Now, the humid room isn't enough to rehydrate a bird, but it can keep it from becoming more dehydrated. The next step after hydration is to see if any fluids can be absorbed through the GI tract. A lot of times falconers with a bird that they think is are low will actually start with this step. And if the bird doesn't need to be in the hospital, this step is a reasonably appropriate place to start. If they can absorb fluids through their crops, then that's a good sign, and you can rehydrate the bird that way. Once you've assured that a bird can absorb fluids this way, then the next step is adding a little bit of dilute sugar solution to the isotonic fluids and seeing if that absorbs. That sugar solution will provide a little bit of energy directly to the lining of the GI tract. We don't typically spend a lot of time in this step. After that, we will see if the bird can eat and easily to digest protein. Canned AD is a dog and cat product that will go through a feeding tube, and we will commonly try that first with the sick raptor. Carnivore Care is a powdered product that you make into a liquid solution, also for syringe feeding in an emergency situation. And there's a company that makes Amarade, which is also available in a carnivore solution that's also appropriate as a first feeding for sick raptors. And then the next step after that is to feed what we call clean meat. Clean meat is not going to have any bones, not have any skin, not have most organs. It won't have any feathers or fur in it at all. Typically it is muscle, and preferably some dark muscle. So like a good pigeon breast, for example. A little bit of liver or a heart, especially if the heart is still full of blood. Those are things that are all clean meats. And we will usually provide this chopped into very small pieces because it's a little bit quicker to digest that way. We do not want to rinse any of these things because the blood that's on them is actually very nutritious for the raptor. And on the topic of low condition, I wanted to talk a little bit about travel. Travel mostly comes into play if you're attending a falconry meet in another state, or if you live clear across the state, especially in a large state like Texas, from where you're going to be attending a meet. If you're going on a short trip, you usually don't have to do very much. If you're going on a longer trip, 12 or 24 hours, for example, then you have to do quite a bit more preparation, or you may end up with a sick bird at the end of your journey. I recommend that you feed the raptor up a few days in advance so that it's fat enough that it can go 2 to 3 days without getting food and still not be too low. If you have a micro, this situation is going to be different because it is extremely unlikely that a micro is going to be capable of doing that anyway. But we see this in Harris hawks fairly regularly at the NAFA meets, that they will not be fed up enough in advance, and then they will have issues digesting food as soon as they get to their destination, and they'll end up in low condition. You want to travel the bird with an empty crop so that there isn't food sitting in the crop undigested if for some reason the bird's a little too stressed for its GI tract to work. You'll want to hydrate the bird throughout the travel, usually traveling with a spray bottle and spritzing it with water so that it will drink the water off of its beak. Then give the bird a little time to settle into its new location. And when you start feeding it, start with a very small volume of the clean meat like we just discussed in the previous slide for low condition birds. So clean, high energy, liver, heart, dark muscle in small pieces. Make sure that goes through well before adjusting to larger meals. And I would not even recommend that the second meal back have bones or feathers or fur in it because it's just a little bit too much of a stress. So some birds will be more sensitive to problems with this than other birds, and you'll just have to take things slower with them, have them in higher condition before they leave home in the first place, spend more time on hydration with them, and then be sure that you're feeding them small amounts of clean meat. Snake bites are probably more common in Texas than they are in Kansas, where I am, but contrary to internet rumors, Benadryl does not really help snake bites. First of all, I don't know that we have any evidence that histamine is involved with raptor allergies, and the chances of an allergic reaction to snake bite is fairly low. Venom is the far more serious problem, and Benadryl does not counteract venom. And the same thing goes for dogs. So the primary first aid for a snake bite would be to rinse the wound and then get to the veterinarian right away. These are some references that I recommend. The University of Minnesota, which is the bottom link, has online courses in Raptor first aid, Raptor care that would be a really good idea for any falconer to take. The modernapprentice.com has a great deal of information. You've probably already been recommended to go there and read everything they've got. And then the top one is a PDF that has a lot of good information as well. So, all right, questions?
Does anyone have any questions?
Hi, this is Lewis. Can you hear me?
We sure can.
In a previous slide, you had mentioned Pedialyte and being able to digest that, or ensuring they could digest it through the GI tract, the crop. Can you tell us a little more about how you validate that is working, or what that looks like?
Right. So when you give the bird fluids through the mouth and you're careful to drip it down the inside of the opposite cheek, you will typically be able to palpate that fluid in the crop. And after you palpate the fluid in the crop, then you wait an hour or so and you see if that level is going down. You also watch for evidence of fluid leaving the GI tract, typically in urine, or you may notice that the bird passes a fecal that it hasn't previously been passing. If it's coming out the opposite end, then it's almost certainly working. If it's not going to absorb, it's going to just sit in the crop and not go anywhere.
Do you have a suggested amount you start with first for the first?
It's going to depend a lot on the size of the bird. So typically I'm not going to start with more than like 1 ml at first, because you honestly have to make sure that you can even safely get it into the bird. Many birds are going to have a personality where they're going to struggle no matter what you do. And it's just better to get to a veterinarian and get some subcutaneous fluids and then put the bird in a box and leave them alone.
Okay. All right. Thank you so much.
Mm-hmm.
All right. Any other questions? Give a few more moments here. I actually have one on the quick stop. Is there, have you ever had a situation where it hasn't seemed to work, or it seems like it takes more than just a little dab to get it to stop bleeding? So
usually what I do, and of course I use it most often in dogs, because a dog tears a toenail, and they're a lot bigger than most of our raptors. And I'll take a small amount, I'll take a small wad of it basically and pack it into the wound. So if I've got a cut toenail and it's a pretty big diameter vessel in there, then I will usually pour some into the lid and stuff the toenail down into the lid and pack as much volume into it as I can, and then combine it with a little bit of pressure.
Okay, great. Thank you. All right, any other questions? Feel free to unmute yourself and ask a question, or you can raise your hand.
I just want to say thanks so much for this presentation. There's a lot of great information. I enjoyed listening to it, so thank you.
You're welcome.
Yes, thanks both Mark and Sherry. It's very helpful.
I very much agree. Okay. We'll let one more round. Anybody else have any questions or comments I would like to present to the meeting?
Thank you. Appreciate your time.
You're welcome.
Thank you very much, Dr. Sherry. Got a lot of good info out of that.
I'm glad.
All right.
Looking forward to the next Zoom, Mark, whatever it is.
All right.
You know what the next one's going to be? Is there already like a set next one?
I am not sure. Actually, I'm helping Mark out, Lewis. This is actually Daniel Olson. I'm actually in Oklahoma, a friend of Mark's. I'm helping him run the meeting, because this is what I do in IT. I know he's listening right now, but I also know he's on the road. But I am sure he will post something to the Facebook page if he's got something else. I have to admit, I felt this was a really good success. I'm looking at the number of participants. Plus, we are recording this, so this will actually get posted for anybody else who wants to watch this and get this information later on. So I would not be surprised to see another session like this coming up soon.
Awesome. And you're very clear on your information, Sherry. Thank you.
Yes. Alrighty, folks. Thank you very much, Sherry. You lots of great information, even from somebody like me who's been doing this even for a few years, or for 6-7 years. But hey, it's part of the thing is we're always learning. So,
Okay.
all right. Well, if no one has any more questions or comments, you all have a great night. Enjoy your night and enjoy your weekend. Thank you, guys.
Wow. Thanks.
Thanks for hosting this, Daniel.
Not a problem.
Thanks, Sherry.
Bye.
Thanks, Sherry.